Hello, and thanks for watching our educational program about hepatocellular carcinoma, also known as liver cancer. At California Pacific Medical Center, we have a dedicated liver cancer program comprised of expert physicians and staff who have dedicated their careers to understanding and treating liver cancer and optimizing outcomes for patients. Our multidisciplinary team has cared for thousands of liver cancer patients and their caregivers. Hepatologists, surgeons, radiologists, interventional radiologists, radiation oncologists, pathologists, oncologists, and other healthcare professionals are here to offer the full spectrum of liver cancer care, from diagnosis to treatment to each of our patients. In this video, we will discuss the diagnosis of liver cancer, how to stage liver cancer, and a brief overview of the types of liver cancer treatment available. We direct you to specific treatment videos to learn about each treatment in depth. Liver cancer arises from cancerous liver cells. Hepatocellular carcinoma is the most common type of cancer in the liver and develops typically in the setting of a diseased liver, either due to scarring, called cirrhosis, which is a condition in which the liver does not function properly due to long-term normal liver tissue being replaced by scar tissue, or from viral hepatitis, like hepatitis B or C virus. High-risk groups for liver cancer include patients with cirrhosis. The most common causes of cirrhosis in the U.S. are alcohol, fatty liver disease, and hepatitis C virus. Patients with hepatitis B are also a high-risk group for developing liver cancer. And what is unique about hepatitis B is that cancer can develop in those with cirrhosis and without cirrhosis. In these high-risk patient groups, physicians often advise screening for liver cancer every 6 months with an ultrasound study and a blood test called alpha-fetoprotein, or AFP. If an abnormality is found on these studies, we recommend a further workup of diagnostic tests with an abdominal MRI or a multi-phase abdominal CT scan. With the alpha-fetoprotein, or AFP blood test, evidence of a tumor may be detected. However, about 1/3 of liver cancer patients have a normal AFP level. Many patients with liver cancer have no symptoms. However, if a patient does develop symptoms, the most common symptoms are pain on the right side of the abdomen, fatigue, or weight loss. Sometimes liver function worsens as a sign of liver cancer. Liver cancer is diagnosed by sophisticated radiological studies like an abdominal MRI or multi-phase abdominal CT scan. Since liver cancer can be difficult to detect, expert review of these studies by a specialized radiologist is essential. Most liver cancer has a specific appearance on the radiological studies, showing the differences in the blood supply to the liver cancer as compared to the normal liver. Therefore, studying a small piece of liver tissue by doing a biopsy is not always required, but can be helpful when the radiographic appearance or clinical history is not clear. Once a diagnosis of liver cancer is made, patients also undergo a chest CT scan and occasionally other tests like a bone scan or PET CT scan to ensure the liver cancer has not spread to sites outside the liver, like the lungs, bone, or lymph nodes. An important factor in determining what type of treatment a patient can undergo is the amount of liver cancer in the liver and ensuring it does not spread outside the liver. After someone is diagnosed with liver cancer, doctors will try to figure out if it has spread outside the liver. This process is called staging. The stage of a cancer describes how much cancer is in the body. It helps determine how serious the cancer is and how best to treat it. The most common staging system for liver cancer is called the Barcelona Clinic Liver Cancer Staging System, which outlines the number and size of liver cancer as well as provides an assessment of the patient's liver function. Another common staging system is the Milan criteria, which is the criteria for determining if a patient's tumor size and number are eligible for liver transplant. There are various treatments for liver cancer. Each patient at CPMC who is diagnosed with liver cancer has a review by a multidisciplinary team in a conference called a liver tumor board, in which a patient's case and his or her radiology films are discussed comprehensively by a team of expert physicians. The optimal therapy based on the patient's number and size of liver cancer tumors and the patient's underlying liver function and medical conditions is discussed, and those recommendations are then communicated to the patient in a visit or series of visits. There are multiple potential treatment options for liver cancer, including surgical procedures like liver resection, liver transplant, and ablation. Interventional radiology applied therapies directly to the liver, like ablation, chemoembolization, or radioembolization. Radiation therapy, called stereotactic external beam radiation by radiation oncologists, and systemic therapy organized by oncologists. At CPMC, the hepatologist or liver doctor coordinates this team while ensuring that your liver function is optimized while undergoing treatments. Our team also includes support services like expert nurses and coordinators, social workers, and nutritionists to ensure that you and your caregivers have all the support you need during your cancer journey.